Hello and welcome to a new webinar by Nicopure Labs. I'm Patricia Kovacevic, General Counsel and Chief Compliance Officer at Nicopure Labs. Today's webinar is a little bit different. It is going to discuss non-industry voices on tobacco harm reduction and vaping products. Why is this important? Tobacco harm reduction, of course, is extremely important for governments, for consumers, and for the industry. We have seen in recent times changes in the perception of electronic cigarette and vaping products coming out of different countries and different jurisdictions. It's very important for you, our audience, to be aware of some positions and some communication tools that you could possibly use with your respective audiences to communicate the science as well as the more credible source positions on electronic cigarettes and vaping products as they pertain to harm reduction. Historically, tobacco harm reduction focused on conventional tobacco product control, measures such as taxation, packaging, and product features. With the new vapor products industry, tobacco harm reduction dialogue should refocus on alternatives to smoking that can offer a sustainable net population benefit in the area of tobacco harm reduction, acknowledging that some individuals will not, may not be willing to, or cannot discontinue nicotine use entirely. This presentation will offer a brief introductory selection of statements regarding the role of vapor products in tobacco harm reduction. There are many other valid points of view and respected individuals and organizations that we have not quoted in the interest of time and space. I apologize to them. Of course, my intention is to discuss them in future webinars. For full disclosure, there are other voices that question the tobacco harm reduction value of vapor products. Since the respective individuals and organizations are rather outspoken, we trust that consumers, industry, and other stakeholders will have access and judge these statements on their scientific merit and not on their emotional value alone. Such statements are also beyond the scope of this presentation and will therefore not be addressed in this instance. So what are the categories of non-industry organizations and individuals we focused on in this webinar? I focused on governments and government-sponsored agencies or institutions, on public health, non-governmental organizations, including tobacco control organizations, as well as on individual tobacco control advocates from various backgrounds, academia, legal profession, etc. Well, one of the most important developments in tobacco harm reduction communication by a government as it relates to vapor products was the August 19, 2015 Public Health England report that was published by the Public Health England, which is an executive agency of the Department of Health in the United Kingdom that has been operating since about April 2013. The Public Health England organization came about as a result of the reorganization of the National Health Services in the UK. The Public Health England report really represents a turning point in communication about potential harm reduction and value of vapor products in potential harm reduction. The report is entitled E-Cigarettes, an Evidence Update, and the key findings of the review include: the current best estimate is that e-cigarettes are around 95% less harmful than smoking. Nearly half the population, about 44.8%, do not realize that e-cigarettes are much less harmful than smoking. And also that there is no evidence so far that e-cigarettes are acting as a route into smoking for children or non-smokers. Of course, the review has many other findings, and I strongly encourage you to read it in detail. Also, bear in mind that the Public Health England review also discusses, of course, information and data pertaining to the United Kingdom. Some have stated that those findings may not apply to other countries such as the United States. Personally, I disagree. I believe that these products are really very similar everywhere in the world, and that their potential for harm reduction in today's flat world should really be considered at global level. Also, with respect to the United Kingdom, The National Center for Smoking Cessation and Training issued a brief in January 2016 on electronic cigarette. The National Center for Smoking Cessation and Training, or NCSCT, was established to support the delivery of smoking cessation interventions provided by local stop smoking services, to support the National Health Services and the local authorities in the UK to deliver effective evidence-based tobacco control programs, and deliver training and assessment programs to stop smoking practitioners as well as other healthcare professionals. This updated edition of the NCSCT Electronic Cigarette Briefing has been written to assist stop smoking services to support people who want to quit smoking with the aid of an e-cigarettes. The briefing brings together all of the latest evidence on the use, effectiveness, and safety of electronic cigarettes and gives guidance to stop smoking services on becoming an e-cigarette friendly service. It includes practical recommendations, details on the Tobacco Products Directive, and frequently asked questions. Here are some of the statements and findings in the electronic cigarettes brief by the National Center for Smoking Cessation and Training. E-cigarettes can support people to quit smoking. Clients of stop smoking services who combined e-cigarettes with behavioral support had the highest quit rates in 2014-2015 in the UK. Low levels of toxicants and carcinogens have been detected in e-cigarette liquid and vapor, but these are much lower than those found in cigarette smoke. I may add several orders of magnitude lower at times. The concentration of toxins in exhale vapor is much lower than that in side stream and exhaled cigarette smoke, and is expected to pose no measurable health risk to bystanders. Concurrent or dual use of cigarettes and e-cigarettes has been associated with increased motivation to quit and with a reduction in the number of cigarettes smoked. Use of e-cigarettes by never smokers remains negligible, and evidence does not support the view that e-cigarettes are acting as a gateway into smoking among young people. As you can notice, these findings by the Government of UK expressed in this briefing are in stark contrast with some findings and statements of the Food and Drug Administration here in the US, and we should probably all ask ourselves, why is that? In the United Kingdom, a very prominent non-governmental organization, the Royal College of Physicians, issued a landmark report on April 28, 2016, so very recently. The Royal College of Physicians is an independent professional membership organization and registered charity in the UK, which represents over 32,000 physicians in the UK and internationally. The April 28, 2016 Royal College of Physicians report aims to provide a fresh update on the use of harm reduction in tobacco smoking in relation to all non-tobacco nicotine products, but particularly e-cigarettes and vaping products. The report concludes that for all the potential risks involved, harm reduction has huge potential to prevent death and disability from tobacco use and to hasten our progress towards a tobacco-free society. To that end, one of the report's key conclusions is, however, in the interest of public health, it is important to promote the use of e-cigarettes, nicotine replacement therapies, and other non-tobacco nicotine products as widely as possible as a substitute for smoking in the UK. I strongly encourage you to read this report and to use it in your communication with your stakeholders. It is a very, very important document, and we really hope that it will mark an era of better communication on the matter of tobacco harm reduction and vapor products. Another non-government organization, also from the United Kingdom, is the Action on Smoking and Health, also named ASH. ASH was established in 1971, in fact, by the Royal College of Physicians. It is a campaigning public health charity in the UK that works to eliminate the harm caused by tobacco. ASH claims it does not attack smokers or condemn smoking. The organization is at present headed by Chief Executive Deborah Arnott and is governed by a board of trustees. One of the goals of the organization is information and networking to develop opinion and awareness about the tobacco epidemic. Their focus in advocacy and campaigning is to press for policy measures that will reduce the burden of addiction, disease, and premature death attributable to tobacco. Now, ASH is really not a very popular organization, in all fairness, with most in the tobacco industry, and recently I believe it started communicating more closely with the vapor industry. However, their briefing in February 2016 gives very good indications of where ASH stands with respect to electronic cigarettes and vapor products. So, in the summary of the February 2016 ASH briefing, it is stated that electronic cigarettes, of course, deliver nicotine in a vapor rather than a smoke form. Obviously, this is a fact. Compared to tobacco products, electronic cigarettes are significantly safer. In the UK, these devices, meaning electronic cigarettes and vaping devices, are used primarily as an aid to cutting down or quitting smoking. And the evidence suggests they compare favorably with other stop-smoking aids. Also, in the UK, there is no evidence that use of electronic cigarettes leads to a take-up of smoking or smoking initiation. And of course, the briefing concludes that electronic cigarettes in the UK will be regulated. In fact, they are currently regulated through the implementation of the Tobacco Products Directive, unless manufacturers opt for products to be licensed by the medicines regulator as a drug, and the medicines regulator in the UK is the MHRA. This is yet another voice that I think joined the rows of those who actually believe that vapor products have an important role in tobacco harm reduction. Let's talk a little bit about voices from the United States. And again, I apologize for not even trying to cover everybody and anybody who has an intelligent, informed, and obviously science-based opinion on vapor products, on their potential for harm reduction. But of course, time doesn't permit that, and also I believe the goal of this webinar is really to stimulate your interest to look for sources of reliable information about tobacco harm reduction. One of the most prominent writers on tobacco harm reduction and lately on vapor products is Dr. Michael Siegel, a professor in the Department of Community Health Sciences at the Boston University School of Public Health. In a recent blog dated May 24, 2016, Professor Siegel, among other, discusses why anecdotal evidence proves that electronic cigarettes are helpful for smoking cessation. Here are his words, and I strongly encourage you to read his blog and to subscribe to it, because it really is very, very informative, and also he's obviously a very credible source of information. Professor Siegel says, "I'm not arguing that clinical trials of smoking cessation with e-cigarettes compared to other approaches are not needed. I've made it very clear that conducting such trials should be a research priority. Neither am I arguing that anecdotal evidence that e-cigarettes can help smokers quit provides an estimate of the magnitude of the effect. We cannot, from the anecdotal evidence, determine what proportion of smokers who attempt to quit using e-cigarettes will succeed. However, the argument that we do not have evidence to conclude that e-cigarettes can help smokers to quit is fallacious. The abundant anecdotal evidence available provides substantial evidence that e-cigarettes in fact can and do help many smokers quit." Again, strongly encourage you to check out his blog. Another well-known academic, Dr. Carl Phillips, previously associated with CASA, the Consumer Association for Smoke-Free Alternatives, and a professor at various universities, including the University of Texas, the University of Alberta, and Harvard, has various writings. His very colorful blog, anti-TIHRlies.com, in fact, really provides very useful criticism of some of the misconceptions and even falsities that are disseminated in connection with the potential for harm reduction presented by vapor products. Dr. Phillips is really very well known and also a very good source of information. His blog is very colorful and he's obviously very opinionated, so it may not be an easy read for everyone. Here is an excerpt from a recent blog from also May 24, 2016. The title is Tobacco Harm Reduction, E-Cigarettes, and E-Cigarette Use, an Overview. I have really taken out of that blog entry a reference to an older presentation that Dr. Phillips has made before the U.S. Senate offices hosted by the American Enterprise Institute. The excerpt I'm presenting you, just as a teaser to encourage you to read, obviously, Dr. Phillips's writings, is in fact an excerpt from a handout that accompanied this March 2015 seminar before the U.S. state offices. So Dr. Phillips says, it is important to keep in mind the absolute magnitude of the plausible range of risk. Even if a particular e-cigarette configuration doubles or triples the health risk compared to that 99% reduction in risk, which is an ideal reduction in risk, it is still a tiny fraction of the risk from smoking. There is nothing to suggest it could be much higher than that, leaving the risk down in the range of that from other everyday hazards, like transport or eating junk food. If such a product, meaning an electronic cigarette or a vaping product, rather than some slightly cleaner alternative, is the satisfying alternative that can replace smoking for a given individual, then the net benefit is obvious. Indeed, if someone merely likes it better, those benefits can justify the costs. We all take small health risks all the time in order to pursue other preferences. Strongly encourage you to read Dr. Carl Phillips's publications, very informative. Let's now turn to a fellow attorney and his writings. The individual in question is Bill Gottschall, an attorney and executive director of Smoke Free Pennsylvania, a lifelong anti-tobacco advocate and also an extremely well-known and respected person in the world of tobacco harm reduction. The excerpt I'm presenting you is really an excerpt from his blog that I strongly encourage you to read. And it's just briefly entitled Tobacco Harm Reduction, an Explanation. The excerpt I chose is really the summary to that article, and it's meant to encourage, of course, to read the full explanation as well as other of Bill Gottschall's writings. Tobacco harm reduction, or THR, in Bill Gottschall's words, is a consumer-driven process whereby safer consumer products are chosen by a purchaser for continued and ongoing use to replace cigarettes. The primary aim is removal of the smoke, and tobacco harm reduction has not been achieved in any form if smoke is still consumed. Substitution is the core factor, consumption of acceptably safe consumer products as a substitute for cigarette smoking. Such products obviously need to be very attractive to consumers. Otherwise, the process does not work and cannot work. What do I believe Bill Gottschall is trying to tell us here? What he's trying to tell us is, yes, ideally one should entirely quit smoking. It acknowledges that there will be individuals that cannot or will not, in fact, quit smoking entirely. However, if there is a much safer alternative that is available and attractive to such consumer, switching from a conventional combustible cigarette that basically delivers smoke to such product is really very important, and the key factor here is attractiveness. You have heard probably discussions around the value of having flavors in vapor products, or whether vapor products, by being attractive to grown-ups, are implicitly attractive to kids. And the fact of the matter is, as Bill Gottschall aptly points out, if a product doesn't sell, if it's not attractive to the consumer, to the adult smoker, obviously there will be very little incentive to switch from a combustible cigarette, which is really the most deadly form of addiction to nicotine, to a product that is a lot safer. Let's now turn to discuss the works of a couple of other very prominent tobacco control advocates. And again, I have to apologize to those that haven't been mentioned again and again. You are, of course, aware that many of these individuals are always on the conference circuit, and most of them, in fact, their works are published, or they write opinion pieces in magazines. I think it's very important to try to distinguish who are really the truthful, authoritative sources of information. And the goal of this webinar was really to provide you sort of a selection of these names, individuals, and sources of information. So, other prominent tobacco control advocates. Clive Bates is a very respected and prominent lifelong tobacco control advocate. He's, among other, a former Director General with the Welsh Government, a former head of ASH, Action on Smoking and Health, the NGO I was mentioning on a previous slide, and a member of the British Prime Minister's Strategy Unit. Clive has actually conducted extensive work and writing on the topic of tobacco harm reduction and vaping products. His blog, The Counterfactual, is a must-read, I emphasize that, and possibly one of the most comprehensive, visionary, and passionate sources of quality information and opinions. Frankly, I had a very hard time choosing one quote from Clive Bates. It was impossible. I was looking at his blog. I read it, of course, religiously, as well as his other writings. And it was very difficult for me to select one quote or one excerpt over another, because really he does an excellent job at providing the right information, directing manufacturers, retailers, consumers, governments, and frankly, every other stakeholder of the vapor industry to very, very valuable source of information. Of course, he writes tongue-in-cheek, and that style works for some, doesn't work for others. But certainly, The Counterfactual is the must-read blog for anybody interested in tobacco harm reduction and in the vapor industry. Well, let's turn now to Canada. Canada is an interesting country with respect to its relationship with electronic cigarettes. Obviously, to this date, we certainly, electronic cigarettes are not properly regulated. In fact, there is also confusion between, I guess, the laws of the different provinces and the law of the country of Canada, or the federal law. And who else to describe or to address the position of the Government of Canada better than David Sweener, an adjunct professor at the University of Ottawa and also lifelong anti-tobacco advocate. David Sweener really has an extensive body of writings in various publications. He also has a lot of speaking engagements, obviously, that are at different conferences, as well as TV. And the excerpt I chose from him, or the two excerpts that I chose from him rather, are from a couple of articles he published recently. One is called Differential Taxes for Differential Risks Towards Reduced Harm from Nicotine-Yielding Products. The publication is the New England Journal of Medicine, and the date is August 2015. He's a co-author with Frank Chalupka and Ken Warner. Here's what he says, or what the authors say. The current approach of imposing taxes on ENDS, which stands for electronic nicotine delivery systems, or raising taxes on cigarettes and other combustible products by the same amount as taxes on snus and other smokeless products, has the opposite effect. It discourages tobacco users from switching to reduced risk products, encourages dual use, and increases the likelihood that young people who initiate nicotine use will start with the most dangerous products. So the authors, of course, address many other topics in their article, but this is one of the better writings about differential, or better arguments for differential taxes in connection with differential risk profile of nicotine-containing products. Simply put, if you look at the cost of nicotine-containing products, obviously cost is a major trigger for purchases or for switching. And if the cost of an electronic cigarette or some other product that is presents a lot less risk than conventional combustible products is as high or even higher than the cigarette because of taxes, there's a very difficult argument to make for a smoker to switch to such product because we know that smokers are very, very sensitive to pricing. Another excerpt from Professor Sweener where he talks about disruptive technology, one of his favorite topics, and he calls it a blessing and a curse. The publication is Rule Breaker Research, and it's from way back in 2014. David Sweener asks a question that really also provides an implicit answer. Can the rise of e-cigarette as a class of products that is still in the early phase of innovation and improvement do what the refrigerator did for stomach cancer by making the cigarette and perhaps all forms of combusting of tobacco obsolete? So the implication here is one of the most important health revolutions was obviously refrigeration in the 20th century. In the past, of course, stomach cancer was much more frequent because of the manner of curing and preserving foods without refrigeration, in particular meats, and the rate of stomach cancer went down substantially after refrigeration was implemented. I think Professor Sweener here and in other of his speeches discusses that electronic cigarettes may be probably analogous for public health to refrigeration and to other discoveries in medicine such as vaccines, and that we certainly must not lose momentum. The information that we provided here is really, again, just a selection of very enlightened views about the benefits for tobacco harm reduction of electronic cigarettes and vapor products. I strongly encourage you to explore more these and other authors and to choose carefully your sources of information because there is certainly a lot of misinformation out there. This concludes our webinar. Thank you for your time as always, and we will see you for future webinars here at Nicopure Labs. Thank you and have a great day.